More than 6 years after President Obama signed the Affordable Care Act into law, none of the 5 major candidates running for U.S. Senate thinks the law is perfect just the way it is.
You have to develop something new and different.
We need to change some things that will make it better.
I think Obamacare is very poorly designed.
I think Obamacare should be replaced.
Are there some glitches? Of course.
Democratic Attorney General Kamala Harris thinks overall Obamacare is working out well.
And we are seeing millions of people who were otherwise uninsured being covered right now.
But Harris says the government needs to launch a public education campaign to convince more young people to sign up.
Doing more that I think we can do at a state level and at a federal level around, explaining to a 27-year-old why they should be invested in having insurance and having coverage.
Well, certainly when we passed the Affordable Care Act, I was one of those votes for it.
But Democratic Congresswoman Loretta Sanchez also wants changes.
One of the things that happened was the people who are actually residents, legal residents, up until for the first 5 years that they're legal residents, they are not allowed to be in something like a covered California, for example. And I think that's wrong.
And Sanchez says she would make other changes as well.
The other area I think that we need to take a look at is how premiums are paid and what people are actually getting.
We do need to replace it, but we need to understand the basic economic facts related to this.
Former Republican Party Chair Tom Del Belcaro says he would keep some parts of Obamacare, such as letting parents keep children on their insurance policies until the age of 26, and the ability to buy insurance across state lines.
We need to keep that. That was a smart advancement, should have been done years ago.
But Del Belcaro would return to letting insurance companies deny patients with pre-existing conditions, and he would get rid of the requirement that most everyone be covered.
So no, I don't believe in an individual mandate. It distorts the market.
Duff Sondheim, another former Republican Party chair, would also do away with the individual mandate.
I totally reject that. Again, that's the Washington forcing you to buy products.
Sondheim says he would create a system in which people use insurance for expensive, unforeseen injuries and illnesses and pay for most routine doctor visits out of pocket.
And my example that I use on that is that when you are going to the gas station and you put gas in your tank, you don't pull out your insurance card, you pull out your credit card.
And I have mixed feelings whether Obamacare is better than what we had before or worse.
Republican software executive Ron Unz proposes the most radical change to the healthcare system.
Something along the line of what is here called the single payer system. It seems to produce results that are roughly as good as the American healthcare system and incredibly cheaper.
But Unz says the chances that the U.S. would ever adopt a single payer system are nil.
So, I'm not sure how I would suggest solving the problem.
For Commitment 2016, I'm David Bieniek, KCRA 3 News.